Right. Good afternoon, everybody. The Senate Finance Committee is now in session. We are in a voting session, which will begin momentarily. All right. Which analyst is going first? David? All right.
Yep. Okay. The first bill on your list is I won't call it a repeat, but you've had it here before, and then it had to go to B&T, and they sent it back. It's Senate Bill 894. You have a reprint in front of you. If you recall, what the bill does is it establishes that if you got any kind of license or certification from the state, you have to participate in some sort of, for continuing education or education requirements. The expectation is you also participate in digital learning if available. It also established 3 grant programs in the Maryland Department of Labor. And in the reprint in front of you, it's no surprise what B&T had did to the bill. If you go straight to page 5 of the reprint, under the 3 grant programs established by the bill, if you go to the bottom of the page, it was not clear whether there'd be all for fiscal 2023 for each grant programs, which had mandated appropriations. It was not clear which kind of funds would be used. So what B&T did was they specified specifically that for all 3 mandated appropriations for fiscal 2023, that it would have to be federal funds coming down from the COVID Relief Act for fiscal that would apply for calendar years 2020 through 2022. And then if you go to the very last page of the reprint, they also added uncodified language, which further specifies that going forward, only federal funds can be used for any of these 3 grant programs.
Can those funds be used to pay for electric buses so that maybe those federal funds and maybe Senator Hershey will get on board the clean energy bandwagon?
Okay, well, all right. Are there other questions? Okay.
Move favorable.
Just to clarify,
Yes, Senator Hershey?
so in year 2023, even though it says the governor must appropriate the funds, it has to be from federal funds? Is that what you're saying? So any year it has to be from federal funds?
Yes, the mandated appropriations end for 2023, but if you go to the uncodified language in the back, it specifies going forward that it be federal funds.
Okay. Thank you very much.
All right. So we have a motion. Did we get a second? All right. Senator Battle has seconded. Any discussion on the motion? All right. If not, if you're ready for the question, all in favor, please raise your hand. Okay. All right. Okay. Thank you. That passes.
Okay, and the next bill on your list is House Bill 13. This was heard last week. There's no cross-file to this bill. It does one thing, but it affects two levels of government. It specifies that the state or a county or municipal government may not use any state, county, or municipal funds to discourage an employee organization to seek representation or to discourage employees from seeking representation through an employee organization with that particular unit of state or local government.
Okay. Yes, Senator Reedy.
Where does this happen?
I don't.
Excuse me, colleagues. We are in session, and we're trying to hear. Thank you.
Where I was trying to look through the where is this happening?
I don't know if it's happening. Anecdotally, in years past, I think there has been some concerns that maybe it was happening in some levels of local government, but I don't know if it's happening currently. It would just reiterate that they can't use state funds for these or local funds for these purposes.
So just and there's no reprint here, right? Because there's no amendments.
There's no
right?
amendments, no.
So if a state or if a local government or a local government entity provides information about bargaining units. So they just can't even provide any information, really, correct? Because anything in a factual sort of analysis of what a bargaining unit does or could include something that might sound negative to some ears and positive to others, right? So, I mean, basically, we're just saying you're not allowed to provide your employees with any information.
You would have to, the intent would be to stay neutral in these matters, for the state or the local county government to remain neutral as an employer.
Okay.
All right, we have a motion and a second. Is there any discussion on the motion? If you're ready for the question, all in favor, please raise your hand. All right, I think we have the count. Thank you. The motion passes.
Okay, the next bill is House Bill 416. This is a cross-file to Senate Bill 204, Senator Bidle's bill, but it's the House took a slightly different approach than Senator Bidle's bill. The Senate bill established a whole new section of law regarding the training requirements for assisted living programs regarding Alzheimer's training and dementia training. The House just added those requirements to the existing regulatory requirements for assisted living programs, and along the same lines that ended up being in the Senate bill that went over to the House. And then if you go to the back of the bill, there's no amendments here. Instead of mandating that certain regulations be adopted by a certain time under Senator Bidle's bill, this bill requires that the department convene stakeholders to revise the regulations that have been sitting in a certain status since 2016 and to include the requirements in the bill relating to training for Alzheimer's.
Well,
And I
let
believe
me
Senator
ask a
Bidle
question.
has a proposal on this.
Let me ask a question. Which of the two bills is most comprehensive and is clearer and most easily implemented?
Bidle will comment on the House bill.
If I can, Madam
Yes.
Chair, I was actually working with the House sponsor during their negotiations, and I thought that her amendments were good, and I was willing to accept her amendments on the Senate bill.
Okay.
That's how we got it out of the House, quite
Do
frankly.
you want to so move?
So be favorable on this bill.
Move favorable on this bill, please.
Okay, do we get a second? Second. All right, it's been moved and seconded. Any discussion on the motion? All in favor, please raise your hand. All right, Dave. Okay. Thank you.
Okay.
All right, that passed.
The next bill is House Bill 643. This, again, doesn't have a cross-file. It concerns the inclusion of ingredients in a cosmetic, and if you go to page 2 of the bill, you'll see that all these ingredients may not be knowingly included in the manufacture, sale, or delivery of cosmetic products. I don't know what all of these 12 ingredients are, or even more so, but that covers most of the bill. But a person is not in violation. It also specifies that a person is not in violation of this section if the person manufactures, sells, delivers, or holds for sale a cosmetic product that was in a process intended to comply with this section, or trace amounts were unavoidably included in the cosmetic.
Yes, Senator Benson.
I just want to, what is this bill aiming to do? What really is it? I mean, how could this be enforced, David?
Well, there's no specific enforcement attached to the bill, so I would have to go look at the rest of this part of the code. But since it's a new section, I would think if somebody complained to the health department or found these ingredients, the health department could take some action, or they could take them to a court of law. It's also intended to comply with same requirements over in the European Union regarding the inclusion of these ingredients in cosmetics. So there's no specific enforcement mechanism, but it's designed to just say you can't put these ingredients in cosmetics. And if it complies with, I would gather that if it's intended to comply with what they're doing in Europe, where a lot of cosmetics are produced, then it would be consistent with what they're doing in Europe, and you can't include these ingredients in these cosmetics.
Senator Feldman?
But
Well,
the question becomes,
I-
do we
Wait a
have
minute.
the authority to do this kind of thing? Do we, I mean, does the state of Maryland have the authority to do this, what is being asked in this bill?
That would be, you
Does it
know,
apply only, in other words, to cosmetics that are generated here in Maryland, or to those from anywhere in the world, in terms of where they're manufactured?
Madam Chair?
Senator Feldman has a question.
Well, I think the bill pretty specifically talks about, you know, I think this bill, the scope of this bill would be, as it pertains to Maryland, it's manufacturing in Maryland, selling in Maryland. I would just note that there wasn't a single testimony, no testimony in opposition at all to the bill, and there's no fiscal impact. And so it's,
Well, I
with
guess-
so I understand, well,
yeah.
I mean, it's some of the issues that are being raised, nobody thought it enough of a problem to come and actually testify either in the House or in the Senate or anywhere else.
Well, okay, Senator Reedy.
I think Senator Benson asked some good questions, because I'm looking at what it says about Europe, and I understand, I think the sponsor's saying that a lot of things are produced there, so that's why they're looking at the standards, but I don't see anything about what we're doing with the U.S. I would say, in response to the Vice Chair, normally saying that nobody came in to oppose the bill from the industry is a pretty good argument. But we're in the middle of this pandemic. I've had situations where I almost got testimony in late for stuff, because it's a complex process. Not everybody knows what's going on. You could have an industry not, I mean, obviously a national corporation would probably be aware, but there could be some industry that might not be following it. I kind of wonder, we're spelling out all this stuff. She may be right. I mean, it's nothing against the bill sponsor. Some of these things sound really bad, but I don't like the idea of putting stuff in law, very specific chemicals in law, if I don't know kind of what the FDA is doing on it and all that. I mean, would a motion for unfavorable be in order at this time?
Well, there's no motion so far, so I guess any motion that someone makes.
Well, I'd make the motion if I have a second.
Okay, is there any discussion on that motion? Senator Feldman.
Well, if the rationale for the unfavorable is there's information about what's happening at the FDA or not around the other states, or I mean, maybe that's something we should take a day to hold and try and find out the answers to. I mean, like that, I understand the lack of information, but I'm not sure that in and of itself should be a rationale for unfavorable, as opposed to taking a day. I think several folks have talked about, not rushing out House bills. I hate to sort of go unfavorable, then do a little research tonight and find out, by the way, there's 30 states that actually have these laws in place either.
I'm willing to.
You want
Maybe
to
I was a little
move
quick
to
on the
hold
draw.
it?
I'd be willing to withdraw my motion, but I think we should hold it and I just want to know. This isn't like a partisan issue or anything like that. I just would like to really know, like,
Yeah, I
more about
share a concern. I believe the Vice Chair is right, but I do share the concern that it's a scope that I'm not sure the state of Maryland can handle or do anything about it. So let's hold it till we can get some information and we can put it back on it.
and over till tomorrow.
All right, what's next?
Okay, next is House Bill 718. And this bill, it's been amended by the House. It came in with a mandated appropriation for a certain position, but as amended by the House, it does a little more. A couple years ago or last year or so, there was a position regarding for autism strategy and a stakeholder group established in law. This would move that from the Department of Human Services over to the Governor's Office of Community Initiative and require the government to include in the annual budget bill an appropriation to fund the position of state coordinator for autism strategy and advisory stakeholder group. I believe that money is in the budget this year, and as long as that position is there, it's probably will stay there. So it just mandates that they provide an appropriation that doesn't specify a specific amount.
Now, right now, this is located where?
It's in the Department of Human Services or the Department of Disabilities. I can't
And to put
remember.
it from either of these actual state departments into a funding stream in the office of the governor seems not a good idea to me. Why would the governor be managing either of these things?
I guess the governor's office wanted it, or else they would not have put it in the governor's office of community initiatives. I don't have an answer for that.
I can't, do they make a case? I mean, what's wrong with where it is?
There was no money. Would it have been because there was no money, there was no funding source, and I'm sure that for
Well,
her
and one-
working it out, this is where they told her to go and put the money there.
But I mean, do you know that for a fact?
No, I don't. I said
Well, we
maybe.
don't know what's happening. See,
Well, then
I think we
let's
need some information as to
hold the
why
bill.
it's here and why
We'll
you would
find
do
out.
this.
I'll try to get more information about why they moved it to the governor's office of
Okay.
community initiatives.
Thank you, Madam Chair, because I think it's important.
Okay.
Okay. All right, the next bill on your list is House Bill 1210. This is from one of the lesser-known delegates from the chairman's district.
This is what?
This is from the Speaker of the House of Delegates as a sponsor, and if you go to the page, there's a reprint in front of you because there's an amendment, some amendments included from Senator Hershey and Senator Klossmeyer, and I've got some additional amendments from Senator Jennings, which I wasn't able to make copies of, so I'll get to those in a second. But in the reprint in front of you, the bill the definitions are very important to this, what the bill is trying to do here. So if you'll see on the reprint that entity means, and that's who this bill is going to apply to, any commercial enterprise or business that is in good standing with assessments and taxation, or any corporation, foundation, school, or hospital, or other legal entity for which basically nonprofits. This is the category for nonprofits. The next definition is state benefits. So those entities who are involved with the state at some level, these are the benefits they would receive from the state, and it would either be a state capital grant funding totaling $1 million, state tax credits totaling $1 million or more, or in a year, or the receipt of state contract with a total value of $1 million or more. The state contract has to be competitively bid through the procurement process. And then the purpose of this bill is for unrepresented, to determine the boards of these entities, whether there is sufficient representation from unrepresented communities in these boards. So at the bottom of the reprint, you'll see unrepresented community means community whose members self-identify as Black, African American, Hispanic, Latino, Asian, Pacific Islander, Native American, Native Hawaiian, or Alaska Native. There are several groups that this bill does not apply to, and these were the amendments from Senator Hershey and Senator Klossmeyer come in. The first group would be a sole proprietor. This was added by the House. The second group amendments for consideration by this committee would be a limited liability company owned by a single member, or a privately held company of at least 75% of the company's shareholders or family members. The entities mentioned earlier would not qualify for state benefit unless the entity is able to demonstrate membership or underrepresented communities in their board or executive leadership, or support for underrepresented communities in their mission. The Department of Commerce, as well as the Office of Small Minority and Business Affairs, will have to develop a process to measure whether these boards comply with the requirements of, or these entities comply with the requirements of this law, and they have to adopt regulations to carry out this section. There's also a additional reporting requirement if you go to page 4 of the reprint. Every year, these entities have to report to assessments and taxation various information. It would also add their compliance with this law if this bill is passed as part of their annual report. The House added additional language that's further specified that you're talking about only the $1 million in any given year. If it's less or more, or it's a multi-year deal, you're talking about at least the $1 million threshold for one specific year that would be the subject of this of the compliance requirement. And the intent is also to apply if these entities propose to locate in a tax increment financing district or enter into a payment in lieu of taxes agreement with a government. And the bill is only supposed to apply prospectively. And at the last page of the reprint, there is a severability clause.
And all of this is if they want to get grants or credits or some kind of financial benefit.
And $1 million or more.
Okay.
And over $1 million or more. Now, the $3 million. Just a $3 million? Oh, okay. Senator Jennings is offering an additional amendment to raise the $1 million to $3 million in all instances. So you have three amendments here. One to add sole proprietorship or board with a predominant number of family members and raising the $1 million limit to $3 million in all instances.
Well, even with the board, with the family members, if they want state money, they ought to do something. I mean, there's nothing wrong with a family having all state family board members, but if they're asking the taxpayers of the state to give them a grant, they could do something. Yes, Senator Hershey.
Thank you. I would just say, after the committee hearing, Senator Klaus-Meinhardt spoke to the Speaker's staff about that specific amendment because that question came up about family-owned businesses, and Speaker's office was amenable to both of these two, limited liability by a single member and the one that had to do with family members, based on the bill hearing and the testimony.
Okay, the Speaker might be, but I'm not. Let me just say this. If I've been blessed enough that I have a business that could even get as much as $1 million grant from the state of Maryland or from any government, I ought to be willing to have some kind of diversity. If I want people that are going to really provide the money, they don't get a say, but they are the taxpayers to contribute. What do you guys think? I mean, that's just my take on it. Senator Reed.
Madam Chair, just in maybe responding to that, I think these are good amendments. I think they help the bill to be a little more fair. You're seizing on the grant part. I'm concerned about the contract. A state contract of $1 million is not what it sounds like. I mean, I think we all know that's not that much money. So you're talking about you have a lot of
grants.
You have a lot of family-owned businesses that are doing things where they go and get state contracts for like road improvements, or I feel like we don't want to be going after small business to try to help. I don't think we have to pit the two against each other is my point. I mean, I think corporations that are involved is one thing, but I think these amendments are pretty good. I like Senator Jennings' amendments too, because again, I mean, $1 million is a lot of money, but it's not what it used to be. I mean, it's not, especially for like state contracts and things like
You're
that.
right.
I mean,
so I think we could treat contracts differently than grants. Senator Augustine.
Thank you, Madam Chair. I would just say that I think this is a great bill, first of all. And secondly, there is the second part that y'all should, make sure you keep in mind, which it gives a second opportunity, which is to support for underrepresented communities in the entity's mission. What that means is that these folks, even if you don't have the board members that you have identified and you in your mission, in the things that you are doing as a company or as an entity, that you are doing right by the people across the board, underrepresented folks who are historically don't get these contracts. I don't care what the size of it is. That's the facts. That you are paying attention to it. It allows for you, if you want to have the state's business, then you need to work under the state's rules. And I think that that's what that does, and it provides that for across the board. That's why I think that that actually, even in the sole proprietorship, in all these entities, it allows for a mechanism for folks to do the right thing when they're doing business with the state of Maryland.
I like your response. I'm going to say one thing, and I'm calling you. If they not only have a mission that deals with underrepresented people, but they implement it, because having something in a mission statement and doing it are two different things. So I would say we could change that just to the word if they're implementing a mission, which considers those people. All right, who did I told Senator Reedy, and then we'll come back over to
If I could
Senator
follow up
Bottle
with
and Senator Hershey.
with my friend across the way here, you said the term doing the right thing. I don't like the implication that someone's doing the wrong thing because they're a family-owned business that doesn't have diversity in a board. They may not even really have a board. Or what if they decide, okay, we'll go find somebody to put on our board and pay them $15,000 a year to sit on our board so we have a diverse board? I mean, that would be, to me, not right either. That'd be a way to get around some of these kind of requirements. I represent a county that has a very small minority population. And so the idea that somebody in my community that might have a business that didn't have somebody on the board that was a racial minority, I don't think that means that they're like somehow racist or whatever. Now, they should be looking for opportunity. If they're not hiring people, that maybe that's not good, but I feel like this really gets way in the weeds of governing how businesses work. And I understand we're talking about state dollars, but again, we need more bidders for state contracts, not less right now. And putting these kind of requirements on are going to make it much more onerous, in my opinion.
Okay, Senator Bottle and Senator Hershey.
Thank you, Madam Chair. So I want to go to the family-owned business part. I had a C Corp when I was in business. I had a C Corp, and the only members of the board were my husband and myself, and I was 100% owner. So I couldn't have had, anyone else on the board. And I know of other ones in my district that are totally family-owned. And they're good-sized businesses that do business with the state, but they're, there's a brother and a sister with one of their children. They're the board members, and so that's it. I mean, that's the members of the corporation. So I don't know how you force a family-owned business to add members to the board that aren't part of the business structure. That's the part that confuses me.
I'm not saying that you force anybody, but
that's
you
what the
give them
bill's
state
doing.
Money. Okay, Senator Hershey and then Senator Jennings.
Yeah, Madam Chair, I would just say the same thing, and this came up mostly with respect to a number of road contracting companies that have been in business for many, many years that are family-owned entities. And Senator Reedy's right, for us to be able to say unless they, again, bring somebody on their board just to check this box and say that somebody's on it, or they could bring somebody on as executive leader. I'm not in the executive leadership. I'm not sure how you really define that, but they can say that that's exempts them, or support. And again, a colleague mentioned that. I don't know what support means or how that's defined. So again, to me, that's pretty vague on a number of these things. With respect to what Department of Commerce is going to do in the Office of Small Business, just develop, maintain, and post publicly a state equity scorecard that compiles diversity data. So it doesn't even says that they're going to implement this or tell how, if somebody is in compliance or not. That's not what it says. It doesn't say check compliance with this. It just says diversity data, which I'm not sure what that necessarily means. So I think there's some vagueness to this. Also, on that part where it says each entity, develop, maintain, and post publicly a state equity scorecard that compiles diversity data for each entity. Is that every entity in the state? I mean, it doesn't say, I mean, we define an entity up front, what an entity means. Then they say you can't take state benefit, but does that mean we're going to do a diversity scorecard for every entity in the entire state? So, I mean, I just think that it doesn't, well, my point is I'm not sure that it says that. I'm not sure it says, we define what an entity is. Then we say an entity can't receive a state benefit unless it does something. But then it goes back to just say we're going to, compile information on each entity. I mean, I think it should be, as you're saying, maybe clarify each entity that does get, the benefit that we're talking about, but I'm not sure that it says that. So I think that there's a number of things that
Senator
need to be addressed.
Jennings, then Senator Bottom.
So mine's just regarding the definition of how big a business is. You got sole proprietorship, LLC. I think there's one that we forgot to add here. If you're trying to deal with just small business, to carve them out, is a sub-S corporation. Is my colleague 2 seats down mentioned hers was a C corp. That's where it's the corporation's tax, but smaller companies will set up as a sub-S, where the tax is actually done through the owners or shareholders' income, which are usually sole proprietorships, but I don't think it's classified as a sole proprietorship. It's a sub-S corp that we might want to also look at.
Okay, Senator Bottle, then Senator Feldman.
Do you think we can hold this and we can recheck with the speaker and see if she's agreeable with that amendment? I understand that she is. Can we hold the bill?
Well, let me hear from the others who have their hands raised, and we'll come back to that. Senator Feldman and Senator Klossman.
Yeah, well, Speaker, I'm, told the text here is fine with the family-owned firms and the single-member LLC, so at least on those. And we may want to hold it, but I just would say on these issues, just on these two narrow, I'm just envisioning on the floor, for those who would like to see the bill passed, I have this vision of kind of an endless quagmire about just this very issue that Senator Bottle pointed out, hypotheticals. And if the speaker's okay with a couple of the amendments, I really feel to reduce kind of what I envision could be a lot of questions on these very specific items. I really think that we should strongly consider, at a minimum, taking those two amendments that the speaker already supports, just again from the standpoint of a floor discussion. So,
okay. Senator Klossmeyer?
I would just like to say, before Senator Bottle said, let's just hold it and talk to the speaker again, to her office, and just clarify everything, because that's a very important person that we're talking about.
Okay, Senator Augustine.
Thank you. Yeah, I mean, I think that we don't need to speak to her. I mean, she has, and we're going to go with what you guys, our colleagues, have said, that she said that the family-owned and the single-member LLCs were okay, and they're okay. All of it, though, all of these are just mechanisms that people use for any kind of business that they have, based on their tax situation, based on everything else. None of it changes what is underlying in this piece of legislation, which is, if you are doing business with the state of Maryland, you are taking tax dollars, state tax dollars. We can make a policy decision that says that if you are going to take our state dollars, then you should, who you look like, your business should at least have, we got a couple different mechanisms for you to demonstrate that you are helping, working with underrepresented folks. These are a couple different mechanisms that are here in order for people to be able to demonstrate that. And so I think we're fine. We take what the speaker said. This is running out of time, and we keep it moving.
Okay. Is there any further discussion? Senator Hershey.
Yeah, I mean, if we do decide to hold it, I would just like to know, is there any way to know how many corporations get state tax credits totaling over $1 million or more? I understand the state contract part. That's kind of easier to do because that's a little bit of a going forward thing, but as far as getting state tax credits, I'm really trying to find out who all we're lumping into that one. That, it sounds broad, but I don't know what $1 million in tax credits is.
Let's ask the analyst. David,
Yeah.
do you think you could get us some information about who gets the tax credit?
I
Profile.
will find out if it's possible to determine how many businesses get tax credits through the state, totaling $1 million
So why
or
don't we
more.
just hold this to our next voting session? Give David a chance to just check that out.
Thank you, Madam Chair.
Okay. Okay, where are we going next?
Next to me, House Bill 123, the Preserve Telehealth Access Act of 2021. We went through a chart on the last time we spoke about this bill, reviewing some of the differences between the Senate bill and the House bill. You've got a reprint in front of you that reflects some amendments that Senator Augustine is offering. Senator Augustine can elaborate on just the context for these amendments, but Senator Augustine met with the chair of the insurance subcommittee in HGO this morning and came to agreement to the set of amendments that are reflected here. So first, I'll just direct you to page 4 of the reprint. This is an amendment that aligns the House bill to the Senate bill by providing that telehealth coverage requirements under the Medicaid program is subject to the limitations of the state budget.
Okay.
Moving on to page 8 of the reprint. This also relates to the Medicaid coverage requirements in the bill. As you'll recall, there's been a lot of, a lot of discussion about what we're calling some of the patient consumer protection provisions in the bill, and this is in the Medicaid section. There was some feedback from the Insurance Administration over the weekend where they offered some suggested language that they felt was clearer and more enforceable. And we'll get to those in a minute because they're in the insurance part of the law. But this provision mirrors what is in the insurance part of the bill by providing that the program, the Medicaid program, can exclude from coverage a behavioral health care service provided to a Medicaid recipient in person solely because the service may also be provided through telehealth. You'll know that this particular protection relates to behavioral health care services, and that was a limitation that was requested by the chair of the House subcommittee to keep this particular part of the bill tailored to those services where some of these concerns have come up. Moving on to the next area of the bill where there's a change worth noting, that's on page 11 of the reprint. This provision here near towards the bottom aligns the House bill with the Senate bill by including in the insurance coverage requirements that a carrier must provide coverage for telehealth regardless of the location of the patient at the time the telehealth services are provided. Next, on page 12 of the reprint, this is in the insurance section of the bill. Again, the patient choice protections. And based on some feedback from MIA, this language is more clarifying and enforceable from their standpoint. And this provides, like the Medicaid section does, that a carrier may not exclude from coverage or deny coverage for a behavioral health care service that is a covered benefit under a health insurance policy or contract when provided in person solely because the behavioral health care service may also be provided through a covered telehealth benefit. Finally, I think that brings us to page 15 of the reprint. There's a couple places where there's uncodified language in the amendments. The first is at the top, and this is the requirement that the Medicaid program revise its regulations regarding telehealth to ensure that they're in compliance with mental health and substance use disorder service parity requirements under the Federal Mental Health Parity and Addiction Equity Act. This aligns the House bill to the Senate bill. And then there's new language, study language for the MIA, which requires MIA to study how telehealth can support efforts to ensure healthcare provider network sufficiency, to study the impact of changes in access to and coverage of telehealth services under health benefit plans offered by health insurance carriers on the ability of consumers to choose in-person care versus telehealth care as the modality of receiving a covered service, and then to provide any findings and recommendations from its study to the Maryland Healthcare Commission for inclusion in the report, the big report relating to telehealth that's required under the bill. So the study already had a provision in it which would have required the MHCC in doing its analysis to look at the use of telehealth in meeting network adequacy standards. But this is specific language for MIA to study the issue as the regulating entity and then provide findings and recommendations from their study for incorporation into that report. So those are the amendments that I think have been a part of the discussion between the Senate and the House.
Thank you. Senator Bottle.
Thank you. I just want to make sure, probably a lot of us got a call from Kaiser Permanente about.
Can we all speak up so the public can hear us
Okay.
too?
So we probably all got a call from Kaiser Permanente concerned about a plan they have that encourages like no deductibles or co-pays when they use certain telehealth programs. We didn't exclude that in this legislation, did we? I mean, this is a lot of changes in this bill. Is it now excluded? I know it's going to be studied. I see that on page 16, but have we eliminated that opportunity for Kaiser?
So the MIA, in their proposed language, believes that it achieves the objective of not forcing a patient to access a covered service through telehealth just because it's available and preserves patient choice. They also believe that the language would permit a carrier to offer a special service, a separate service that has telehealth-only aspects to it. So one example of a service that has been raised relates to chronic disease management, where certain management of chronic disease conditions is provided through telehealth consults. So that was an important piece of the discussion that I think the MIA amendment addressed. A second issue that Kaiser has raised was how that language was drafted originally, because there was language that said that a carrier must allow a patient to select the manner in which a service is provided as appropriate under the health occupations article. MIA agreed that it was somewhat confusing the way that the language was drafted because it seemed to put the carrier in the position of being involved in this decision-making that happens between an insured, a patient, and the provider. So with the reworking of the language, it's more clarifying and establishing some restrictions on the coverage that a carrier must provide. So I think that was a clarification that addressed some of the concerns that have been raised by Kaiser.
Thank you.
Senator Augustine.
Thank you, Madam Chair. This was a lot of work, members of the committee. I really have to thank Patrick. I mean, he worked very hard on this, and I'm really grateful for that. I also just really thank Delegate Cullison. I mean, we've worked together to try to come up with somewhere where we're moving forward the telehealth and also providing some protections for consumers at the same time. And then I just also must say that Commissioner Bahrain, Patrick did not mention this, Commissioner Bahrain assembled her entire team, and we talked, we had an excellent meeting Friday afternoon. They worked on this over the weekend. Everybody worked on this over the weekend to kind of get this into the shape that it is in right now, which I think really does really does do a good job of pulling everything together in a way, and I would just ask that the body move favorable as amended.
Okay, we've got a motion and a second. Any discussion on the motion? Now, or if you're ready for the question, all in favor, please raise your hand. Okay, that carries.
Okay, the next bill is HB 849. This is public health medical records fees. You do have a reprint for this bill because there are, I think, some corrections that need to be made to the bill and the amendments. The bill and the amendments, in an unintended way, change some provisions of current law relating to medical records and the fees that may be charged. And so I will highlight them. But just for your recollection, this is the bill that prohibits a healthcare provider or representative of the healthcare provider from charging a fee for providing copies of a medical record requested by the patient's personal representative, or an employee or other representative of a nonprofit legal services entity or other volunteer or nonprofit program representing the patient, that will be used for the purpose of filing a claim regarding or appealing a denial of Social Security disability income or Social Security benefits. And as I mentioned, the amendments are corrective in nature. There were some provisions in here that were changed unintentionally, provisions in current law. So those would be the amendments to move.
Okay. Any discussion, any motions? Senator Biden.
I can make a motion, but then I have a question.
Okay.
Okay, so I'll make the motion. Okay, thank you.
Okay, got a
So-
motion before us in a second. Now, Senator Biden, what is your question?
What is the charge? It looks like it says not exceeding 76 cents for each page. Is that that's on page 2? Is that what they're charging, 76 cents a page?
Yeah, that's the current law charge for pages
So
for a
we
medical record.
So are we taking that out?
No, the bill was originally drafted, made a number of changes to the existing law relating to the fees for medical records. All the amendments that the House adopted struck out those changes to keep these current law provisions in place. What's new is all of the new language that's on page 3 of 4 of the reprint. That's what's left. And these are the provisions that specifically relate to the charging of fees when for this purpose of filing a claim regarding Social Security benefits.
And so what is the fee now?
The fee is as it is currently under current law, which is 76 cents for each page.
And not a limit? There's a preparation fee not to exceed $22.88?
Yes, that's current law as well. That remains the current law.
So that's plus 75 cents a page, plus $22.88?
Yes, so an entity is allowed to charge a preparation fee of $22.88 for retrieval and preparation. That's the current law.
It's outrageous to make a copy. Thank you.
Any other questions? Did we get a motion? Okay. Are you ready for the question? All in favor, please raise your hand. All opposed, raise your hand. Okay, thank you. That passes.
In HB 1034, this is the Prescription Drug Affordability Board Plan of Action Repeal of Date for Submission. This bill repeals the date by which the Prescription Drug Affordability Board would be required to submit a plan of action for the process of setting upper payment limits if the board finds that such a plan would be in the best interest of the state. It's currently the case that this report deadline is July 1st, 2021, but as you know, the Prescription Drug Affordability Board had some delays to get up and running, and so this bill just repeals that date for the submission of that plan.
Okay, do we have a motion?
Move favorable.
All right, it's been moved and seconded. Any discussion on the motion? All right, all in favor, please raise your hand. Okay, that looks like unanimous. Thank you very much.
The next bill is House Bill 6. This is a bill that deals with TEDCO's board and also the renaming of the executive director to be the chief executive officer. There's a reprint in front of you. As amended, House Bill 6 will be identical to Senate Bill 80. The amendment specifies that the representative appointed by the governor to represent a historically black college or university, in that situation, any single historically black college or university may not be represented for more than 2 consecutive terms.
All right, it's moved and seconded. Any discussion on the motion? Yes, Senator Benson.
Madam Chair, I don't know whether we should bring this up or not, but I was a little concerned about the testimony that was given regarding evidence of discrimination with TEDCO. Is that something we need to take a look at? We give TEDCO a lot of money, but that testimony that was issued by that young lady is a little concerning for me. I don't know whether we should take that, but we've heard this. If you all will recall, Senator Kagan had some issues with TEDCO some years back. I'm just wondering whether or not it's something that we should take a look at.
I read what the young lady said. She was an officer in TEDCO. She no longer has the position. You don't know when you get a situation like that. And there have been several changes of the hierarchy. You had the Major General who used to be during the interim, Singh, who used to be over the National Guard, the Maryland National Guard, and now you've got the new Mr. Tony Stovall. Sometimes a person loses a position when there's a major change. Everything I read what you said, but there was no evidence of anything presented, and I'm not sure we're the ones to try. I mean, she simply is a former employee.
Okay.
He lost the position, so
I know that there's been some changes.
and she could go to the EEOC. You know, if there's a problem, she knows how to do that.
Okay, I've got confidence in a couple of those people that have been brought on by TEDCO.
Right.
But I was just wondering. Okay, thank you.
Okay. All right. Where did we leave off? All right. We had a motion and a second. All right. Any further discussion? All right. If you're in favor of the motion, raise your hand. All right, that looks unanimous. Thank you.
Next bill is House Bill 556. This bill is identical to Senate Bill 430, which passed the Senate unanimously earlier this session. It authorizes the PSC to hold virtual hearings.
Second.
All right. Any discussion on the motion? Not, or if you're ready for the question, raise your hand. If you're favor. Okay. Senate, okay. Was that unanimous? Any opposed? Okay. All right, let's move it.
House Bill 558 is identical to Senate Bill 429, which passed the Senate unanimously earlier this session. This bill makes administrative changes to the for-hire driver's license application process, removes a requirement for a Baltimore City taxicab driver to complete an education course, modernizes requirements related to the display of information on taxicabs, and removes taxicabs from the list of motor vehicles that are not required to have seat belts. Provisions related to passenger limousines that carry 15 or fewer passengers are expanded to encompass all for-hire motor vehicles of the same size.
Let me just start by saying one thing. I'm a little bit worried that we almost are knocking out taxi cabs. A lot of people who are poor can't afford to use a credit card and be calling Uber or Lyft or something else. That's one thing. Also, taxi cab drivers get a salary. They know what they're going to earn. Their Social Security is taken out for them. They get pensions. And I know that they are disappearing breed, but it's almost if we don't watch out, we'll knock out a lot of jobs for people that are not college-trained people. They aren't bad jobs, and where they really have some benefits they can latch on to, because there's still in federal courts even are questions about whether the Uber and Lyft folks and so on are independent contractors. They get nothing. They buy their own gas, they pay their own car insurance, they have no benefits whatsoever. All right, so that was my question. All right, now I said my bit. Is anybody making a motion to do anything?
Madam Chair, we did pass. Is this in the same posture? I'm sorry. Okay, so we already passed this bill in the Finance Committee, and it's a month ago, so just, I'm not saying you can't raise an issue on the...
Okay, but what are we doing
Oh, I'm
today?
sorry. I apologize. So wait, just so I'm clear, this, okay, never mind. We passed this in the exact form, right? Yeah, move favorable.
Okay, do we have a second? Okay, any discussion on the motion? All in favor, raise your hand. Okay. Okay.
The next bill is House Bill 578. It is identical to Senate Bill 428, which passed the Senate unanimously earlier this session.
Now, was this the one we heard today?
No, ma'am.
Okay, all right. All right, go ahead. Okay, any discussion on the motion? All right, all in favor, please raise your hand. All right, that looks unanimous.
The next bill is House Bill 654. There's a reprint before you. The bill alters the terms Small Business Innovation Research Grant and Small Business Technology Transfer Grant for purposes of the Maryland Small Business Innovation Research and Technology Transfer Incentive Program administered by TEDCO. The bill alters the circumstances under which an award or investment recipient may be required to return certain funds, requires the program to prioritize awards to certain small businesses, and expands the type of businesses to which the program is required to conduct marketing and outreach. There's an amendment offered by Senator Augustine that expands the types of small businesses which the program is required to conduct marketing and outreach to include minority-owned businesses.
Okay. Any discussion, any amendments, any motions? Okay. And Senator Bottle, did you second it? I did. Okay. Any discussion on the motion? Okay. All in favor, please raise your hands. All right. Any opposed, raise your hand. Okay. I don't know. Hershey didn't do anything. Well, people have a right to abstain.
What's happening? Senator Reedy, what are you doing?
He didn't have to do anything. They can abstain. Are you raising it for or against? I just don't know. Okay.
You are for.
Okay. Okay.
Next bill is House Bill 989. There's a reprint before you as amended. House Bill 989 is identical to Senate Bill 714, which passed the Senate unanimously earlier this session. This is the bill that deals with changes to the regulatory structure governing the state's 911 system. The amendments conform the House bill to the Senate bill. These are the ones that Senator Hayes had offered after reaching a compromise with the sponsor of the Senate bill to require the board to report certain demographic employee information related to 911 specialists to the General Assembly, provide a plan for implicit bias training, and expand the responsibilities of the board to require outreach to minority groups.
Okay. What is your pleasure? Okay, we've got a motion and a second and a discussion on the motion. Okay, all in favor, please raise your hand. Okay, that's unanimous.
The last bill before we have a few withdrawals to discuss.
All right, let's be sure we are listening, and remember, the world is listening in.
House Bill 1004, this bill does not have a Senate cross-file. House Bill 1004 modifies the process for and circumstances under which a Maryland chartered credit union may engage in any additional activity, service, or other practice that is already authorized for federal credit unions. The bill repeals an existing requirement that credit unions receive the approval of OCFR before moving ahead. Instead, it allows a credit union to undertake an action after filing notice of the intent.
There was some opposition on the House side on that. Can I just hold this until I can find out what that was about?
Okay, you want to hold it until when?
Next week sometime.
Well,
Or next voting session, I'm sorry.
okay, next
Yeah.
voting
Thank you.
session. Okay.
Okay, then the final matter is there are 3 withdrawals. The first is Senate Bill 194, Senator Benson, Correctional Services Inmates, Labor, Training, and Educational Courses. The second is Senate Bill 322, also Senator Benson. This is Health and Wellness Standards, Correctional Facilities, and Healthcare Facilities. And finally, Senate Bill 949, Senator Hershey, Public Utilities Bills for Electricity Service Meter Readings.
Okay. I guess, should we vote to
To withdraw.
withdraw? Okay.
Unfavorable with unfavorable on this.
Okay, can we get a second? Okay. All in favor of the motion, please raise your hand. Okay, thank you very much.
I'm not sure Senator Reedy wanted to be recorded.
Nathan, to concur? No?
Okay, thanks so much, everybody.